So now it gives me great pleasure to welcome Margaret Foster. Margaret has just been so helpful in putting this series together for us. So Margaret is the evidence-based evidence synthesis and scholarly communications librarian and head of the Center for Systematic Reviews and Research Synthesis at the Medical Sciences Library, Texas A&M University. She is the co-author of the first book written on systematic reviews for librarians, Assembling the Pieces of a Systematic Review, a Guide for Librarians, and recently Piecing Together Systematic Reviews and Other Evidence Synthesis. She received the Presidential Impact Award from Texas A&M University in 2018 and the Lucretia W. McClure Excellence in Education Award in 2024 from the Medical Library Association. Thank you, Margaret, for being our guest speaker. And now I'm going to turn everything over to you.
You're muted.
Oh. Yeah.
Thank you for that, and thank you for joining us today. Let me get this slideshow ready for y'all. And I know there was a question on the Padlet, and I answered that question already in the Q&A. So if you asked that question, you can go and look at it, or if you're curious as to what it was, you can go look at it. It was basically asking about meetings with clients and potential correlations between that and the success of the review. So today is our last part of this series. And so today we're going to be talking about kind of all the stuff that could happen potentially after the paper has been sent in and published. And so we're going to talk a little bit about some preservation that you can do, the data of the systematic review, potentially archiving the search, and then tracking its impact. We're also going to talk throughout about the role of the librarian in promoting the review potentially, and then determining when it's time to update the review. And describing how to set up the consultation service will be just a few slides kind of at the end. And maybe the better thing was I should have worded this as to the things to think about when setting it up, because we won't have that long to talk about it, but I did put together a few slides for you to look at. So I divided this kind of into 3 parts, but we're definitely going to spend the most time in part 2, and about half of our time will be talking about preservation and your role in that. So it'll be a little bit about the pieces cycle, going through those, the last 4 phases, and then a little bit about running the review service there at the end. So I designed the book and this workshop to be around the review cycle. And we've been going through these 8 phases. And so when I had imagined the review cycle, I had thought a lot about the first 4 steps. And then when we were thinking about people to add into the book, I really wanted to pick people who could really speak to the last 4 steps, because that wasn't my comfort zone. In putting this slide deck together, I realized that there's been more things published, and I've gotten a lot better understanding. So there's several things in here that you would not find in the book. And so I think the handout for this session is a little bit longer than the other ones. So hopefully that's useful to you. The other thing is that, there's a lot out there about data management, and there's a lot out there about impact and things like that. So I'm just going to be focusing on what is different or interesting about systematic reviews. So I'm not going to be covering those topics in a lot of depth other than that part of it. So hopefully that helps. So in talking about the phases of the review, we've gone over that proposal where we're just kind of figuring out, what's the scope of this review, what makes sense here. Then we got into the protocol, and then you deal with a little bit more. And then so as you see in the little rectangle I have there, you're taking a little bit more sips out of the water cup. You might think about that as a water cup. And so you see like there's a little bit more space, a little bit more of the water's gone, and then we get down to the paper, we processed all of it. So that's kind of how I divided the steps up, was to kind of indicate like how much you might go through for that step. Because of course you don't want to go through too much until you've really figured out what you want to do in that section. When we get into the next 4 steps, this is where it really starts to be a little bit different. So the phases can overlap, definitely, and data management and the preservation of the project, it's not really a phase that you're doing after the paper gets published. It's something that needs to be thought of throughout. But I think it was easier to talk about this at this point than to have to talk about it when we were busy talking about all the things you do in the protocol. And so your promotion stage can also start at the same time, because in developing that protocol, you might start then thinking, or your researcher might start thinking about the stakeholders who needs to know about this, because they may even want to involve them in the protocol itself or in some part of those processes. But definitely once the paper is published, then they want to get the word out so that other people know about it. And then impact tracking, as soon as any attention is getting maybe to the protocol because they had it registered, or maybe they went and did a poster or something. So that tracking can start sooner. So you have the attention that everything's being getting, but you also have, okay, what is the impact of this? So we're going to talk about some specific types of impact you might think about for review. And then the update, this is where, they've published it, and then maybe they have some kind of algorithm or plan for when they're going to update the review. And so that's where I kind of wrote at the bottom of this that in the timeline, some of these plans can be set way in the beginning, but sometimes people don't start thinking about them until after the paper is done. But I think some work needs to be done sooner than that. Okay, so let's get into this. So we're going to start with preservation. So I'm going to talk a little bit about, okay, what are the competencies around systematic reviews, data management, and preservation. And then I put some slides together on the data management plan that's specific for systematic reviews. And then we'll end up talking a little bit about the preservation of the search and search archives, things to think about for that. So I thought I'd ask a little question here, like what have some of you done around data management? Have you submitted to a search archive? Have you done a data management plan for systematic review? You could just type in the chat box and kind of let me know what your experience has been with that. I've never gotten to fill out the complete data management for systematic reviews with a group. I have had some groups that needed to fill out something about it, and usually it's just been like a little paragraph. I have submitted a couple of searches to a search archive, but the one that I did was a long time ago, and I don't even think it exists anymore. So, okay. So you put it in your institutional repository. Yeah, that is definitely a good place. You could do that too. Okay, so some of this, for a lot of y'all, it seems like this will be some new information. Okay. There we go. So I got this competency from the article by Whitney Townsend and the rest of her colleagues there. I won't read them all out, but this article has been very useful to me in thinking about competencies and things to help others get trained on, and also things to think about for myself. So there was a competency in there called the data management competency, and they basically listed 4 things to think about. So citation software, systematic review software, data extraction tools and forms, and then the last part talks about appropriate data and process archiving, including things like for the Prisma data collection. And so that kind of helped me to think about things that I might need to train librarians working for my service, and things to think about in the future, future training as well. And so I put this together. The next set of slides are all about this data management plan for systematic reviews. So there's a nice template. There's an article that was published about the template, and then there's a LibGuide that's out there that provides a little bit more guidance and some examples, but it doesn't have it for the whole form. I think it only goes through maybe question 5, but it's still another useful source. And all of these are on the handout that you got a link, I think, up at the beginning. So the form is 7 questions. It's starting with data collection and then moving through and then thinking about, you get to preservation round 4 because, of course, you've got to collect everything before you can get into that preservation part. And then we'll get into a little bit more sharing, and then we'll talk about archiving the search. So in that data collection, this is where we're talking about like types of data and things like that. And so for in most systematic reviews, we usually don't have like sensitive data. There are some systematic reviews where they do have actual patient data, but for the most part, like I've never done one where we had actual patient data. So usually it's not like sensitive data, but you still want to help the team think about the types of data that you might be giving to them, and that might be different than what they've seen before. So those like RAS files, things like that. And then when it comes to like whatever structure, procedures they want to do, maybe you have a consistent way of labeling those RAS files for them. I know that's what we do in our service. That way we know which client each one is for and which search it was, and always the date on there because we know we update searches from time to time. So it's just thinking through like, what are they? How are we going to name them kind of thing. And then thinking about, okay, what kind of information do you need to go along with that? I did put in this citation for a suggested data structure for how to write up your search. And we're going to talk about that in a few more slides, but I kind of added it in this section because it might help for that. And then they might want to assign somebody to just keeping track of this. Some projects are smaller and don't have as many kind of hands in the pot. And then I've worked on some projects where there's like 10 people on a team. And so sometimes they'll just assign somebody for this. I also want to think about where's all of this going to be stored and how is it going to be backed up? And then making sure that everybody has access to it. And it gets a little bit more complicated, as we all know, when people are at multiple institutions. I know I've had issues sometimes with Dropbox that they were trying to get me into with some groups. And I think at some point I had like 10 different Dropbox accounts. So it's all of those kinds of things and trying to figure out like what works for everybody. And there's no like right answer with this. It's just what works best for your team and your institution. And now we get into the question of preservation. And so this is where we start thinking about, okay, what kinds of repositories? I've mostly done Open Science Framework and then our own repository. And that has worked well because I'm able to see how many views, how many downloads, especially of our own repository. I had never heard of this data site page before, and this is a site where you can look for repositories. I did a little bit of searching in there, and I found that if I typed in like a topic, like cancer or something like that, I could find repositories easier around topics. And I thought, oh, that might be interesting. So if we were doing a review on a particular topic, we might be able to go in and find a repository that matches that. And that may be helpful in the promotion part. But I think as far as like the preservation part, maybe having it related to the university or even the open science might make more sense. The Systematic Review Data Repository, if you haven't heard of that, is from ARC. I have had a few grants where they did require that data went into that. It's a free tool that you can use. You can even use it for doing abstract and full text screening. You could use it for your data extraction form. So it's a good tool. At first, I thought, oh, maybe this is going to go away, but now they've done a lot of updating, and it even does some machine learning in there for sorting things. So you might want to check that one out. Okay. Then we get into the sharing and reuse. I added this article in here from Neil Hadaway talking about open synthesis. And so there's been this big call for let's put more and more information out there. Of course, we've been hearing about open access for a long time, and now this is the idea of, your protocols out there, your review report is out there, the data is out there, like really putting this out there for people to use. And so it's all about thinking, who needs this? Where can we put it for them? Of course, making sure like if there's any patient data, that's got to be safe. But just thinking through all of those questions and what the options are. And this may be something that your team hadn't really thought about before. So I think that's what's nice about having a DMP that's specific to systematic reviews. You don't have to have lots of the other things that are in I think other versions of this, but it definitely has a lot of detail in it as well. And then we get into those responsibilities. I think the trickiest part is like over time, like where are these going to live and who's going to take responsibility for them, especially if things change. And so I think that's going to continue to be a question, especially as people move to different institutions and things like that. So I'll be curious if people don't start going more towards something like the open science framework or something for that reason, just so it's a place where everybody can manage and get to easier than some of the institutional repositories. And then also thinking about the costs, like most of the things I was thinking of was free. I hadn't really thought about cost. But then there's also maybe time management. I don't know. And then, thinking about the impact and tracking the attention, somebody's going to need to go in and see like how many times things were happening, right? And then, so that may also weigh in on like, where do you want these to be stored if you're not getting those attention scores or something like that. Okay, we're almost to the last question. And then ethics and compliance, like this is going around, like is there sensitive data there? How are you going to keep that safe? And then there could be other issues, the legal, ethical, intellectual property, all of those kinds of things. And so you should check out those links I kind of had at the beginning. It's going to go through all of this in lots more detail. And like I said, that LibGuide has examples and things on there because I know that always helps me a lot. So I feel like I've been talking nonstop here. This is from Neil Hadaway's article all about his suggested structure for transparent searches. And I thought this was interesting. They have like the 7 things they're listing out about why it's so hard to record these searches and report them. What do y'all think about this list? Let me see. Do you think they covered everything? Do you agree with this list? What do you think? Nobody wants to say anything. Or maybe you're reading it. I know it's a little long. They're so true. Yes, it is hard. Yeah, so we do have the Prisma S guidelines for reporting the search. But I think even within that, there are a lot of variabilities. Yeah, a lot of room for error. I would agree with that. sometimes you can tell that people tried to type it back up again and they made mistakes. Or sometimes in copying and pasting, I've seen like mistakes made, like where the lines were numbered, but then when they copy and paste, the lines kind of got out of whack maybe. Um, and yeah, this is where we come in, right? And then I think the other thing that makes it difficult for reproducing searches is number 6, where all of those places where people might be searching, they can change. And I've had that happen to me before where complete platforms went away and were bought by another platform. And so all the searches I had done for that one, now anything we had published on them won't work in there anymore, of course. And then any new ones, any updates, we were going to have to do in a completely new platform. So anyway, so I thought that this was interesting how they kind of laid out these 7 things. And in the article, they have, I think, about a paragraph for each one of these kind of going over it. So then, yeah, having the supplemental files is a big problem because you don't even get to see them, or sometimes you can't find them. So I think that that continues to be a problem. So in the article, this is the structure they suggested, and it's very nicely laid out. And within the article, kind of like how they've done in Prisma, they go through each one of these like kind of checklist items with descriptions and definitions of what does that mean, and giving you a chance to give more information, more details about the search, not just the search itself. And one of the archives that you could put it in is called the search archive. And on the next slide, I think is where I put, there we go, more about this. So of course you could put this in your institutional repository, and I definitely have done that with a few things. This is another option. This is also an option for going to search for a search on a topic that maybe you wanted to see what somebody else might have done. Of course, this is still growing. It's doesn't have a lot in there. I don't exactly know what the number is, but this is a place where you could go and archive a search, and it gets a DOI, and then you could know like when people are citing it and things like that. One thing to know about if you go and search this, and I kind of put this at the bottom of this picture here, is that the advanced search covers all of CABI, so you're pretty much stuck with this kind of one-line search here if you're searching it. But like I said, there's not a lot in there yet. And so, for example, I put in like cancer to kind of see what came up with that. There was a presentation given in June, and you can actually see it if you go to the link that I put there. And this was really nicely done, that these librarians shared their experience of adding their searches into Search Archive. So check that out. Okay. A few other things about storing the search is I found this tool called Search Recorder. It's a really interesting tool. It's completely free. And what you do is you can add your search history into the RAS file itself, so that people know where that information came from. And so there's been an article published about that. And on the next slide, try to put a little bit of picture in here to help you like see what they're doing here. And what's nice about it is they give you like some examples that you can try. And then of course, hopefully you can see that little tab. It says try it yourself. So it starts off with you've got to format your search history a certain way. And it follows that same pattern that I was showing you that was developed. And so you get the search history into the format, and then on the right side here, the column, I have the embedded search data, and that's where you can kind of see how it fits into the RAS file that can then be downloaded. The form that they used, I think I saw, was JSON. That's a similar kind of styled to what the clinicaltrials.gov also does, that format as well. So it's a little bit similar in that kind of idea. So what are some issues that you think about um, in either using these or putting in your own searches? Do you have any like worries about it, or do you have any questions about putting things into that? What do you think? Privacy, confidentiality. Yeah, so definitely they wouldn't, we know they won't last forever, um, but they would be archived there. Um, yeah, so I have thought about maybe I need to, if I were going to do this, talk with my client first. I know I've read in some places, I think it said wait until it's actually published before you put this in there. Um, so let's see. Yeah, so it could be something that you talk with the group right up at the front about whether or not you're going to archive this search somewhere. So, so that's a good idea because we know we always want to communicate with them and have those expectations set up. But there's a limit on what you have access to. Okay, and so it sounds like for most of you, your questions are it's a lot around talking with your clients, making sure that maybe they're okay with it, maybe waiting to publish in the archive after, perhaps. Um, but I think the idea that we know we've got to save, um, maybe save this somewhere. And I think earlier somebody was talking about, oh, sometimes the search is put into like the supplemental um, or the appendix of the journals. And I feel like sometimes those are not always easy to find. Um, yeah, getting credit for them. And so I think having that DOI and being able to cite it easily, hopefully that helps with that. Yes. So, and I think, I think no matter where you put it, maybe getting it registered with a DOI, even if you don't put it in something like Search Archive, might be helpful. And letting people know like how to cite it, so that they can copy paste. I know that will, that might help to make sure too. Okay. So this is great. So now we'll talk a little bit about promotion. This isn't something I've gotten to do with a lot of groups. It is something that some of the groups I've worked with have done. And so what I tried to do in here is just give you some tools that maybe you give to groups. You may not be super involved in the promotion of things, but I think knowing a little bit about what's out there about it can be helpful. Um, so part of this idea, like I said, is maybe not waiting until the paper comes out, although certainly some groups don't do a lot about this until the paper is published, but maybe trying to figure out who are those stakeholders, maybe involving some in earlier parts of the process, but definitely considering those stakeholders. You want the information to be relatable no matter who you're talking with, right? And then we know like Cochrane has their plain language examples, but having something that the layperson could understand And then I think that relatability, connecting with people kind of goes hand in hand. And definitely that transparency goes in there. Okay, I spelled Cochrane wrong in that one. I need to fix that. I'll write that down. Okay. I use these two guides to help me build some of this, and then there's other citations throughout this. Cochrane actually has some really nice videos on this as well. And so if you have a team that's really thinking about this, watching the videos might be the most helpful. But there's also some short checklists that they can look at. And then they can, if they have questions about the checklist, thankfully that it has longer and better explanations throughout the guide. So it's really nice. So these are kind of the general 6 steps. There are different frameworks, and especially the public health folks get really into the frameworks, but there's different frameworks depending what you're trying to do with in promoting the research. And then, of course, thinking about the stakeholders and their characteristics. And then what are those outputs? What are those channels that would be best for those stakeholders? And then there's another checklist that's all around the content and images. And then, of course, before putting out some of them, maybe seeking feedback from those particular representatives from those different groups to see. And then maybe even from like marketing and media people could be helpful. And so, like I said, this isn't something that all groups will do, but definitely some might be really interested in this. And even if they just did like 1 or 2 things, that might really help them to also boost up their citations of their work as well. So there's actually a website where they can go and find models for dissemination. If what they really want to do is also help with the implementation of anything that they figured out, this also has models in there. Like I said, a lot of people I work with wouldn't necessarily go and do this and all the steps, but sometimes they'll like pick from some of these that they want to do. But I thought this was really nice to have this database. In identifying their stakeholders, thinking through everybody that they want to go and talk to about their review findings, things like that. And it could be they want to go and talk to funders to get more grant money. I know I've had many people who've come to me to do a review because they do really want to go out after certain grants, and they were using it to build up evidence for that. So in thinking through these different groups, and then once they're thinking through the different groups, what are those characteristics? So I'm curious, has anybody worked, I know it's pretty rare, but has anybody had an experience that their team actually did go and talk with stakeholders that you knew about? Not yet. Yeah. Okay, so I was just thinking, have any of you worked with a team where they added stakeholders in some part of the review process? So we got a yes, it involved behavioral health interventions. So artists, which part of the review process did they involve their stakeholders in? And what kind of stakeholders were they? Were they researchers, patients? Oh, I see, Jean. Yeah, so it's great to involve them in that part of it and early on. Yeah, and this does take time. I mean, there's definitely a lot of barriers in there. Most of the stakeholders that I've worked with have been the experts on the topic that were informing the protocol. I haven't really had a group that worked with patients um, or like consumers or anything like that. Yeah, this is, oh, so the clients involved, they were involved in the search terms. Okay. Let's see. So thank you for sharing your experiences there. Um, I was thinking it was pretty rare, and it's kind of confirmed my idea there. Okay. So then, as thinking through each stakeholder, these are like kind of four things that the team could think about. Thinking through what's the level of interest that that stakeholder might have, and how much time would they be willing to give to listening or reading, whatever it is you have. So maybe you're just going to have like a one-page flyer. Maybe it's like a policy brief um, for policymakers or funders or something like that. Thinking through what sources those stakeholders have, which ones would they feel is credible, and what information do they need? Is there additional information they might expect? Um, and then especially for Cochrane reviews, they really try and limit like recommendations. And you'll see that kind of in their when they're saying like the summary of the findings and stuff. So that is a part of what they're saying here. I know that when I look at other groups and what they do, usually they do have recommendations in a part of that. And then thinking about like the format of it as well could help to inform. Oh, and Jean was saying that's not added into the grant costs. Um, so I think it would depend on how they developed it. I know one group that I was working with, they started working on with their stakeholders way at the beginning and had a dissemination plan like throughout the project, and it went further on after they were published as well. Okay. Then thinking about all the different channels and outputs and things, and this would really depend on who those stakeholders were and who they wanted to talk to. There's guidance from the CDC, like if you're writing policy briefs. I've used actually that link a lot in my public health classes because sometimes they have to write policy briefs. So it's a nice kind of step-by-steps and has, I think, a description of 4 different types of policy briefs. And then this other article, it talks about the whole process of disseminating research and has details on these other options. So like I said, really depending on the stakeholders that they're trying to reach. Sometimes reviews, because of their topic, get a lot of news attention right off the bat. And the team doesn't even have to like seek these out necessarily. They get into the news, maybe the nature of it, of the topic and things like that. And so kind of having a plan and what they want to say can help. And of course, in a lot of institutions, they would work with their marketing team for that as well. This is that checklist I was talking about. I think it's actually it's split onto 2 pages here. I can't remember if it's 16 or 18. But anyway, so it goes through this kind of checklist. A lot of this is content and thinking about the stakeholders themselves. And like I said, the guideline is really nice in that it has like this brief checklist, and then for each thing it has a couple pages, usually written with more details in it. So you can see things in here that you would expect, like is it in plain language, talk about relevancy, making sure that like numbers and things like that are easier, I feel like, for the layperson to understand. I thought it was interesting, line 9. Have you stated that this information is from a systematic review? And I'm wondering, like, then do you go on to explain what it is? Because, of course, not everybody would know what that means. And then kind of goes on, talks a little bit more in here about numbers, certainty, explaining the findings in different ways, conflicts of interest, things like that. So it's a really nice checklist there. There's a separate checklist that's just for images itself. And so I thought this was interesting to have like a whole other list just for images. I was also thinking that to me there might not be as much information as they do need here or guidance about like graphs and any kind of like statistical data that they might put into an image. Most of this information is more around like pictures, I think, and making sure that they're relevant. Um, so what do y'all think about this checklist and especially like these images? Um, do you think you might use this checklist maybe for other reasons? What do y'all think? Yeah, and in this guideline there are there's like details for each one of these items. So um, make sure your faculty feel better. Yeah. Um, yeah, so I think sometimes there's like these hidden gems, like the Cochrane website is so massive and there's so many like little corners in it. Um, and pulling out these checklists from there and kind of adding them to my list of things to be ready to hand people has been very helpful. Yeah, and thinking about posters especially, I think that's right. Yeah, the permissions thing can sometimes be difficult. Okay. So next we're going to talk about impact. And as promised, I'm not going to spend a lot of time on this um, because there's a lot, there have been many wonderful webinars and guidance on tracking impact, attention, and things like that. I'm going to really try and focus on things that are unique to systematic reviews and giving you some tools that you might share with your clients. I think it's great if we can, kind of celebrate their publication. I feel like a lot of times I'm so busy with other reviews that I really don't take the time to celebrate, like, yes, it came out and like really celebrate with the team. I'm trying to figure out like other ways I can do that. And then later down the road, like if I see, oh, it's been cited or this happened, that could be something, that I could highlight with them as well. So just something to think about. Okay. I don't know why sometimes it doesn't want to move forward. Um, so when I was thinking about this, I started thinking about things that we track or try to track. And so I started listing this, and I'm curious if there's other things that I have here um, that you might think about. I know I'm like back-to-back questions here. There's probably some of y'all who are much better at this than me. Um, I don't work with clients to do this. Um, we have other librarians that do this a lot. Most of my work with this has been things I've done for myself. So I'm just curious if y'all could think of something else that should be added here. Presentation bibliographies, but that's an interesting one. I wonder how you would find out. Where would those be indexed? Clinical tool mentions. Hmm. So those would be maybe like umbrella reviews. Um, so that might be like a deep dive into the citations themselves. So Oh, I'm just realizing I didn't put anything in here about like news media. I only put social media. Adding one to the list. Um, I know I recently worked on a review that got some attention um, in the news due to the nature of its topic. Um, and so that's definitely one type of attention there. Okay. So, so as we're, thinking about gathering, like what would we track so that could go into the planning, things to track. Then we get into the okay, well, what kind of impact is that? Because we've got our numbers, and then there's the really important part of putting that into context. And so the next couple of slides are tables and kind of definitions of different kinds of impact. This is more like um, words or vocabulary that we could provide to the clients when they're having to write up like annual reports or things like that. And so I thought this was really nice. It kind of covers different settings that impact may have happened, and then things that may be short term, and then moving out to the longer term. So what we have been talking about, I feel like, has been a lot of the those shorter term things. Like it's been cited, it's been you know, it's been in the news, things like that. Um, and then some of you were mentioning things like clinical tools, things like that, and then getting further out into like policy. Um, and so then we can see over time, those scores are building up, the altmetric scores, things like that. Um, And then we see across the different practices that it takes a little bit more time for it to actually get into the policy itself. So maybe just the policymakers get aware of it and then they're actually using it. And then I think some of you were saying things that might be like longer term things as well. Um, so I felt like this was helpful in kind of thinking about what are those things you might see at the beginning and what are some things you might see later on. Now, right now, the things I'm trying to think about is more about this one project. Of course, their overall packet of work, that would be a different thing. But I'm just trying to think about, okay, this one review, what has been the impact of that project? So the next couple of slides are going to come from this report that came out of the Epicenter when they were trying to look at the reviews that they had published over time and what impact did that group of systematic reviews have. But they were evaluating each systematic review on its own and then kind of scoring it a little bit to see the types of use that it was getting. And they labeled 4 types of use. So I found this really interesting. So they had transparent use through understanding or accessibility, and then embedded use and instrumental use. And so I felt like these were basically talking about uses they could see and then maybe uses they had to kind of look at different evidence to see, okay, has that been used? Hopefully on the next couple of slides, this makes more sense. It's a little bit dense, so I'm sorry about that. I'll leave them up on the screen for a little bit here. This report is completely free online and it's in the handout that I gave you as well. So what I found really interesting about these 2 tables is each one is looking at impact either through the government or non-government impact. And then for each level of use, they have like these different scores that you could give the review. So I thought this is really nicely laid out. Maybe not as easy to find out all of these things, but at least it gives you some kind of framework that you could share with a client if they were trying to figure out, this bigger kind of impact that they might have. And so they, for each level, you've got scope, you can get between 1 to 3 points. For depth, the same, and sustainability. And then you see that for each of these different ones. And so, for example, under transparent use and knowledge accessibility, under depth, this is where, did you put it in a knowledge repository? Did it have a summary that went along with it? And things like that. So some of these are actions actually that the review authors could take to help to reach that level of impact that this is talking about in those uses. So I think that's nice too. I don't think that you can always kind of increase your chances of impact. And this is giving them some of those examples of actions they could do. So the next slide is very similar, but it's talking about the embedded and then the instrumental. I'm very curious, had some of you seen this before? What do you think about this kind of framework for almost like giving them a score? I think altmetrics might reflect a little bit of these kind of uses, but I think you have to kind of read like the different levels of use here. I think some of this might be a little harder. And so I think like you could get it in, if you looked at altmetrics, you could say, oh, it's been used by this policy, and you just see like the citation of the policy, but you might have to go in depth to see, well, how much is it being used? And which of these might it apply and how in depth and things like that. So I think altmetric gets you started, but this might push you a little bit more into like the context level. I know this is very dense. This is definitely something I've had to sit and look at and think about. So I'll kind of move on from here. Yeah, so, like if you have reviewers that have written some, yes, there's lots of interpretation. Now, this is a very long report. There's a lot of detail in it. And I tried to pull out the most useful parts of it for like starting to get into it, but if you want to read, there's definitely lots of detail in here. So I shall move on. Okay. So now we're going to talk a little bit about updating. Now, this updating is not talking about while you're trying to publish. We're talking about it has been published, it's done. This is talking about later down the road. So what is an update? Why update? There's a decision tree. And some of this might be helpful in that if a group is looking at a review that they're thinking about updating, this might answer some of those questions. We'll also talk about where do living reviews fit into this and some of the Cochrane standards around this. So what is an update exactly? And so this is a definition from 2016. And you'll see, I've also seen this in Cochrane as well. So this says that a new edition of a published systematic review with changes that can include new data, new methods, or new analysis. And so in reading that, it's important to think about that you may be updating that review, but you're not limited to the original methods. That's something that I feel like a lot of teams get really stuck on. Oh no, we're just updating what they did. And then sometimes I will say, but their search was not great, or there's some issues with it. And really to update that and use maybe better tools that we have now, things like that. And sometimes you don't necessarily have to have new data. It could be that there's better tools, better searching. We have access to more databases than they had, things like that. So there's a lot in this that it's not necessarily like, oh, we're just going to update that, right? It's thinking through all of that. I think the next couple of slides will help with this as well. Um, so why update? So maybe some new studies have been published. If those new studies agree, like they say, yeah, this is a great intervention, adding more studies into a review and that analysis might be adding to the precision, increase the application of it. You'll know how this works with more patients, things like that, more sub-analysis. If they don't agree, like now these new studies are saying, oh, maybe this intervention is not as great as we thought, then that's an important finding as well. It needs to be out there. And then just kind of what I said on the other slide, maybe there's no new studies, but maybe the group is taking a different perspective, or there's a new rubric that's out there for rating the quality of something. So there's a lot of nuance in here. It's not just, oh, new studies have come out, we've got to do this. This decision tree is also a part of this article, and they created a Creative Commons for it, so I thought that was really nice. So this can be used and put out there to help, I feel like, with clients and stuff, to kind of see this is the decision tree for when to update, so this might help. Also, like I said, in that beginning part, oh, there's this other review out there. Can I do this? So you kind of see thinking about the question, and are there new methods, new studies, things like that? And then you've got your rationale along the way there. I know this is another one of those very, very dense slides. Oh, so many changes occur. Oh, oh, if y'all can look at this for 1 second, my son's school is calling. Just a second. I'm so sorry.
We've all been there, so we can give Margaret some time.
Did I switch it to this new one accidentally when I got up? Maybe I did. So that's fine. So this is talking a little bit about living systematic reviews. And I think sometimes when we're thinking about living systematic reviews, it can be like a little bit confusing with this update. And so living systematic reviews are just reviews where they've said, hey, we're going to update this often. Here's our algorithm. Here's how often we're going to do things. And so they're just kind of setting that up in the beginning instead of, groups coming together like years later and saying, oh, remember that review we worked on? Let's do an update. And so these are some additional tasks that need to be done if they say they're going to do a living systematic review. And then there's, of course, additional reporting for that. And so now Cochrane has actually a community around these. We're starting to see more standards coming out for them. And there's some topics that lend themselves better to living systematic reviews than others. And, these could be around technology, an emerging kind of illness, other things. And we saw some of these kind of popping up before COVID, but definitely during COVID is when you started to see even more, especially these dashboards being developed, that you could go in and you could see like new things that were added. Let's see what else to tell you about these. And I think that that up-to-date communication and deciding like where this is going to live and picking the right platform for this can sometimes be difficult. And the other thing that I was reading about was, and sometimes I have thought about them in this way as well, is that Cochrane reviews, I always thought a little bit like they were living systematic reviews, and that they are updated on a pretty regular basis. Any questions about living reviews? I know I just have, oh, thank you for the hearts. I just have this one slide on it. I didn't know, like, have y'all read or looked at living systematic reviews before? Have you worked on one? I haven't gotten to work on one before. A little bit more uptake. But like I said, I haven't really been able to do one myself. But I think we're seeing like more and more technology and people being willing to take on reviews more because I think of the tools that are out there. But I think it's, the other issue is the amounts of data that's out there to go through. Hopefully one day AI will become that thing that can actually help us sort it more. Um, but I don't think that we're quite there yet. Yeah, this is going to require a lot more time. I'm really curious around the funding of them. So, if you had a living systematic review funded, like how far would that go? Would it be for like 5 years? Like how long would that last? Because sustainability, I think, is a big problem. Um, yeah, when something changes fast. Yeah. The answer was no. I think it is a very daunting task. I mean, even just doing a Cochrane review can be very daunting because I think you need to agree to update it on some type of regular basis. So, um, yeah. So Travis, your question on in a living review, do you write the frequency of updates? Yes, you've got to, if you say you're going to do a living review, in the protocol itself, you do need to talk about how that's going to be done, what the frequency is. That's curious about the search evolving. I mean, it might not evolve. Well, if it was a really new topic like technology, like maybe AI, maybe it's going to evolve a lot because of new tools coming out that would need to be added to the search. So that might be a part of it. So I think this is one of the most interesting types that's kind of coming out. Um, One of the articles that we talked about really early on in this series was the Meet the Family article. And in that article, that's the one, I don't know if y'all remember, it's been a little bit, but they divided reviews into 7 different types. And they didn't mention living reviews until kind of like the end and like the future of reviews. Um, and so I think there's still a lot to be learned about these. Um, and so I think the search probably will need to evolve over time. Um, so I think that's going to continue. Okay. So like I said, groups won't always be thinking about updates. Maybe they're just glad to be done with the report and not think about it anymore. Some will start planning from the beginning. Some might along the way start thinking about, oh, if this happened, if there's like 5 more articles come out, then we'll do an update or something like that. But sometimes they just decide a few years later, hey, oh, enough stuff has come out. Let's write another one. Let's update it. So I've seen groups do different things, but I haven't got to do the living review yet. So, okay. So there are some meeker standards for what to do if you're updating a review, and of course they would have standards for this. So the meeker, I can read you real quick what it stands for. That's the methodological expectations of Cochrane intervention reviews. And so, of course, they do require that reviews are updated on a regular basis. So they have there's 5 standards for planning, and then there's more standards on the next slide for conducting. And this kind of shows how it's not just, oh, I'm going to rerun the searches and add those in and be done. You can see here how they're saying, okay, look at your question again. Does the question need to be updated? look at your outcomes, look at the eligibility criteria. There's all of those things around it where you're really reconsidering all the parts of it. It's not just an update. Um, and then once that is really thought through, then that's when they need to think about, okay, what needs to be changed from the search since we're going to do that. And then, of course, changing the data collection and potentially the analysis as well. And this says may need to submit a new protocol. And that's for like Cochrane's point of view, right? Whether or not they need a new protocol, they will decide. As part of my cycle, I was showing that, you get down to the update and then that's when you're going back to the proposal where you're thinking about, okay, we're thinking about updating this. And now we need to think about how feasible it is to update it, what needs to be changed, and then the whole cycle starts again in that. Okay. Oh boy. Okay. Sorry. There we go. One more slide here. So these are the conducting it, and this is where you see the talking about, okay, the search needs to be updated within 6 to 12 months. They prefer 6 months of publication. And I've seen a lot of medical journals have copied that same kind of timeline there. The next thing is, of course, identifying new studies, and this would come from that updated search that may need to be modified, like we talked about in the beginning. Also, even thinking about those studies identified before, maybe looking at retraction watch to see if anything has come out. Also, if any ongoing trials were identified in the first review, I think they call it original here, then need to think about, okay, have those been published? Are they finished? What's going on with those? Looking at the risk of bias across now all of this and synthesizing it. And addressing all of those things. So hopefully my main reason for kind of showing this was that it's not just, oh, we're just going to take all the methods of what they did before and we're just going to rerun the searches and that's it. Cochrane is really calling on people to really think through all the parts of it and making sure is everything still appropriate, what needs to be changed, adapted, whatever. And I think sometimes I have teams that are like, no, we're very, they want to really lock it down, even though I'm pointing out like issues in there. So it's just something to think about and point out to them if you have a group that wants to update, whether it's their own or a different review. Let's see, we have time if there's any questions about any of that. I think we answered the one that was in there. Oh, maybe the review that never dies. That's funny. When does it need to die? Yeah, so I haven't seen any algorithms for when does a review need to die. So that might be an interesting paper. So. And so now you've seen the whole cycle. I am trying to figure out how maybe to incorporate into the cycle here that idea that the planning of the last 4 might happen during the protocol. I don't know how much more complicated that would make the cycle kind of diagram, but that they do kind of overlap in, but hopefully you can see from each one of these, you might have a document or an output that comes out. So from the preservation, you might have the data management plan. From promotion, you could have the dissemination plan, plus you could have any of those other outputs that come out of that. From the impact, you might have an impact statement of the project. There are actually impact statements that people will submit with a grant that say like potential impact that talks about like stakeholders and things. But then you could have that impact statement, of course, that they put into their packets and things for like going up for tenure or their annual review, things like that. And then from the update, you could have your update algorithm, or you could have a new protocol, things like that. So each one of these has outputs that can come out of it. And that's kind of what I try and encourage my teams is to have multiple outputs, because if they're just waiting for that final paper, and that's like, a year and a half away, that's a long time before they get a win. And I try and think of as many wins as we can think of. Okay. Oh, my question card for that one is here. So any questions about this part, or we'll go on to the services part for our last few minutes here. Just want to make sure. Okay, not seeing anything. So I just have a few more slides here, and of course we can spend our last minutes talking about these and any other questions that you have. So I just put a few slides in here talking with a logic model. So I like using a logic model to sum up the service, and it can also be used to advocate for this service as well. So this next slide is going to be very dense. I tried to get a lot on one page. And hopefully I can talk you through it. You can ask me questions. In all of the citations, there's also a slide for that. And they're all on the handout as well. So just trying to prepare you for how dense this is. I know that I've had many more dense slides on this one than any other part of the presentation. Oh, I put in a little details first. I forgot about that. So you could, logic models can be very different in how they're laid out. There's lots of different ways of doing it. This is just my way that I laid this one out. So I like to have the mission statement on it. That can be really helpful to remember, like, okay, this is like our main day-to-day thing we're focusing on. You could have a background column. You could think about your resources and what do you need to run what you're trying to do. Then you finally have a column that says this is what we're doing. And then you have your goals, which could be like, also think about like could be assessment. But sometimes people have a column that's just for assessment. And then the vision and what you might think about at the bottom, that's like the impact of what we're doing. So hopefully when you see this, it will make sense for you. I know it's a lot. So up at the beginning, and this is in some ways this mirrors what we're doing, but in other ways I tried to make it a little bit generic. But if you wanted to take this and use some of it, you could. I don't know what will be helpful for you. So this first part, the background part, that's where I'm talking about, oh, this could be used for advocating. So in this first column, this is where I'm saying all the facts around, or, well, I feel like they're facts. I do have citations for all of these, but what we know about like systematic reviews, and that they have high potential for societal impact if they're done well, right? And the standards call for librarians to work on them. If a librarian works with teams, then we know that those reviews have meet more of the standards that are out there. Systematic reviews that meet standards are cited more often. And so that kind of, that's my way of kind of showing like the potential impact here. There's been calls for systematic review methods to be part of master's and PhD training, and that's with the open synthesis of open evidence. I might be saying that wrong article. It's number 4 listed there. And then just calls overall for systematic review projects to be more accessible. Then, of course, we know all the challenges, right? We know review authors don't always use the best practices. They don't always even know what the standards are, or they don't understand how to follow them sometimes. And then there's a lot of time that could go wasted. There was one article, I can't remember how old it is now, but it might be getting a little bit outdated. But basically, they tried to look at how many reviews are coming out of institution and kind of predicting the costs of those reviews. So I found that to be really interesting. I think it has a lot of caveats in there, but just kind of thinking about how much money, even if the institution doesn't really realize how much money is going into these reviews based on time, even alone. And then so in the middle part there, for resources, that's kind of how ours is organized right now. Just for the medical library, the main library has its own set of librarians for that. Thinking about things you might need for the infrastructure, we decided to use a ticketing system so that we know when like somebody came into the system for that review, and we kind of number them. A workflow and forms for that. And then just how are you going to do the calendar appointments? Because that can take up a lot of time too, that back and forth and everything that happens. And thank you, Kyle, for taking care of that for me. And then all the software, thinking about what are you going to use for that. Then the programs like who will be served, how they'll be served, engagement that can be done there. And then the last one, those are like some short-term, some long-term goals there. And then I tried to put down there some potential assessments. And like I said, logic models are, can be designed lots of different ways. You'll see lots of different, like how do you use it as a column? This is how I decided to do this one. And then down at the bottom in the vision, it's saying that we want to increase the quality, societal impact, and capacity of evidence synthesis efforts by our campus. So that's where they're a little bit different in the mission and the vision. I know sometimes I get those mixed up. I always have to go and look at those definitions. So what do y'all think about using a logic model for advocating or even just for designing your program? Do some of y'all have used logic models? Have you done this before? I know this is a lot on one slide. Love logic models. Thank you. Yeah, so great. And so feel free to use this. Like I said, some are laid out differently, and not many don't necessarily have a background. Area, but I liked having that in there, just especially for those outside the library to understand what we're trying to do. So, as you're trying to expand your services, yeah. So let's see, we have a few more minutes. I think that might be the last slide. Oh, you're very welcome. So this has all of the citations that I use to build up that first column. And this is something that I've evolved over time as more things have come out. I probably need to go and do another check to see if there's something new that I need to add. You're very welcome. Thank you for that. And so we have these last few minutes. Any more questions? And I know that Margie might have some information for you in a few minutes, but just checking to see if y'all have any more questions. Thank you, artists. I learned a lot putting this together. I learned a lot putting all of these presentations for y'all together and all of your questions. So I thank you for participating. And I hope that this is helpful to you. I know, not a lot of us get to be involved at this part in the review, but I think it's kind of good to find out like what might you do and what might you share. So you're very welcome. Oh, I see a question.
Yep, that's what I was going to say. Yeah, it looks like there's a question.
Yeah, I'll answer with this one more long questions here. So this is saying, there's so much documentation out there for reviews. Why do we keep seeing articles that don't meet the standards? So I think one of the problem is the gatekeepers themselves, right? So the journal editors not holding the authors to the standards, and also not applying them well. I know I have submitted reviews that had reviewers that said things like, what is this Prisma you're talking about, and things like that. So I think the biggest problem is the gatekeepers, but also peer reviewing. I don't know how much longer the peer reviewing system, the way it is right now with volunteering, is going to last. I know I was an associate editor for a few years, and it was really hard to get reviewers. And I just wonder, like, what else would we do? But I think the biggest problem and what you're talking about is the gatekeepers, and the peer reviewing is just not holding people to those standards. So
thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.